Hello and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you, whose lives were forever changed by a medical diagnosis. I'm Lita.
I'm Ron.
And I'm Jean Marie.
Collectively, we're the hosts of PodcastDX. On today's show, we're speaking with Norman. Norman is the founder of Men with Fibromyalgia and active board member for the International Support Fibromyalgia Network, as well as the program director for their veterans programs.
Hi, Norman. Good morning.
Hello, guys. Thanks for having me on.
Norman, first off, I heard you're a veteran. Thank you so much for your service to our country. We recently had the pleasure of interviewing another veteran named Crystal concerning her fibromyalgia diagnosis. Now, we would like to hear about your journey. From your perspective, what can you tell our listeners about fibromyalgia?
Well, fibromyalgia is one of those illnesses that the medical community still don't know what causes fibromyalgia. Currently, by the National Institute of Health and the CDC, they're calling it a central nervous system disorder. There is some questions whether it is degenerative or not, but I like to say that fibromyalgia amplifies other medical conditions. I also have chronic fatigue syndrome, osteoarthritis, degenerative disc disease. And fibromyalgia takes the pain from seemingly minor conditions and amplifies the pain, which makes sense as a central nervous system disorder.
Sure.
So fibromyalgia is the amplifier to other chronic conditions.
Got it. Well, that's a good definition. Norman, when were you first diagnosed? How long did it take you to get that diagnosis?
Well, personally, I believe I've had fibromyalgia since before 2009. But in 2009, I was in a vehicle accident. Actually hit a here dead on about 3 o'clock in the morning.
Oh.
Totaled the vehicle I was in. And that was really the major start of my symptoms.
Okay.
I know a lot of people with fibromyalgia say there's a triggering event. And I really look at that as my triggering event.
Did the deer actually hit you, or was it just the collision and the shock? Well, sometimes the deer will come through the windshield.
Oh.
Yes, it didn't come through the windshield, thankfully. But, I was in the middle of nowhere. I think it took about 45 minutes for the ambulance and the cops to come out to me.
Oh, wow.
Yeah. So, but as I said, totaled the vehicle I was in. About 2012 is when the VA really started questioning what's going on with your chronic pain, everything else. My wife's best friend had fibromyalgia, and we'd actually gotten together. My wife had thyroid issues. We'd recently read The Spoon Theory by Christine Mesmeradino. And we're all geeks, so we started a Facebook page called Spoon Geeks, talking about having fun with chronic pain.
Okay.
That was short-lived, but during that, it sort of gave me the strength to say, hey, your symptoms and my symptoms are a lot the same. Maybe I have fibromyalgia. Took it to the VA in 2012. At first, I was told by a male doctor, well, that's a woman's disease. You can't have it.
Oh.
Flat out, period, dot, the end. And a very old school doctor, so I worked with the VA to say, hey, I don't like this doctor. We'll get a new one. So they prescribed me a second doctor. And this female doctor said, well, you're too young to be in that much pain. Really, it's all in your head. So
Wow.
There's no way you can have fibromyalgia.
Wow.
So, again, went through the patient advocate, got a new doctor. The doctor I had at the time, he said, well, most men don't get fibromyalgia, but let's send you to the rheumatologist. Okay, so we did that. The rheumatologist did her pressure point exam, which, of course, is no longer valid. But at the time, the 18 trigger points, I think I had about 16 of them. So she said, well, you possibly have fibromyalgia, but that's for your primary care to decide. I went back to my primary care, and he said, well, that's for the rheumatologist.
Yes, we understand
That's
that.
the pinball effect.
Everyone passing the buck.
Yes.
The good thing was they sent me to the pain clinic within the VA at the same time. And I told the same thing I just said now to the pain doctor. She pulled up the file, and she said, well, your primary care says you probably have fibromyalgia. Your rheumatologist says everything lines up, and you probably have fibromyalgia. So I'm going to give you the diagnosis.
Okay.
And that was 2.5 years later, so middle of 2014.
Okay.
Wow, that's a long time.
Well, yeah, that is a long time.
Yeah. So it was definitely a long and convoluted way to get the diagnosis.
Okay. Well, Norman, you said that you knew someone with fibromyalgia, but had you ever heard of it before you were diagnosed or before you started having symptoms?
I had heard a little bit about it because I'm one of those people. I was raised by, at the time, what would have been now considered a naturopathic doctor.
Oh, okay.
He was my uncle, and always did a lot of research. Mom helped him with some of his research. So anything medical, I tend to dig in on.
Mm-hmm.
Say, what's the best self-treatment?
Mm-hmm.
So I think between 2009 and 2014, I had heard about it a little bit, but I had really dismissed it because most of what I was reading was it's a woman's disease. Men don't get it. So anything I saw in fibromyalgia, I tend to skip over until I found out my wife's best friend had it. And
and that was a man
identical.
also. Okay, yeah, I didn't realize that your wife's best friend was also a gentleman.
No, my wife's best friend, she's a lady.
Oh, she's a lady. Okay.
Yeah. But her symptoms and my symptoms lined up so identically, it's like, maybe I need to take a better look at this, and that was in 2012.
Okay.
And that's when I really started realizing, wait, this isn't just women who get this.
Mm-hmm.
Since you were diagnosed, how your condition has been treated, what you've been doing, what have the doctors been doing to treat it?
How do they treat your disease?
At first, it was aquatherapy. They, of course, put me on NSAIDs, which either naproxen or ibuprofen, different muscle relaxers. The pain was bad enough. There were some days I couldn't get off the couch, so they gave me tramadol, which I was taking 3 to 4 times a day for pain management. They put me on gabapentin for a while, which turned me into a drunk dyslexic, according to my wife.
Yeah.
Then they tried me on Lyrica and diflocanac. I can't remember the generic name on that. After a couple years of that, all of a sudden I had high blood pressure, high cholesterol.
Oh.
They wanted to put me on even more meds. And I started looking at the side effects of the medications.
Mm-hmm.
And the Lyrica and the diflocanac, which mixed together, are really bad on your liver, and they cause high blood pressure and high cholesterol.
Okay.
The high blood pressure meds and the cholesterol meds would cause an increase in pain, which, of course, would trigger the fibromyalgia, which would mean increase in meds to manage the fibromyalgia, which would mean an increase in meds to manage the blood pressure and cholesterol. And I personally got to the point, I said, this is going to be a nasty cycle and we need to get off it. Over about a 9-month period, I weaned myself off of pretty much all my medication, except for basic NSAIDs, muscle relaxer, and I take those once a day, twice if needed. And then I only use the tramadol now for really severe breakthrough pain, which is about once every couple of weeks.
Okay.
But it does sound like just a dominoes effect with all of the different medications and the side effects and everything. It sounds like a lot.
Right.
And you've been through a lot with that.
Right.
Exactly. The side effects of the side effects were just a loop upon a loop.
Right. So who was doing the prescribing? Is it the rheumatologist that takes care of you, or the pain specialist? Who's the go-to at the VA for this?
Within the VA, it's actually the pain clinic.
Okay.
Who I'm working with. She prescribes most of the pain medications I need. We haven't been following up with the rheumatologist, but she has been getting me into aquatherapy and different classes within the VA. One of them is the CBD training, which is the cognitive behavioral therapy.
Oh, okay.
There's also the ACT therapy, which is active cognitive training. Both very similar, but different tools to use to help distract from the pain.
Mm-hmm.
And also to recognize that where I used to hate the statement, pain is all in your head, the truth is pain is all in your head, because your nervous system sends the signal to the brain says, oh, you're in pain, and sends it back down.
Right.
So learning to distract or not dismiss the signal, but sort of interrupt the signal a little bit.
Right.
So instead of a really strong TV signal, you're getting a blurry picture.
Right, right. So
You know,
you're trying to focus on something else stronger or harder so that you can't focus on the pain as much.
Exactly.
And I think that's why a lot of people say that the pain is worse when they're trying to fall asleep at night, because you don't have all of the distractions and your mind has really nothing else to focus on but the pain.
Yeah, that makes sense.
Yeah, and I have to say that in being a veteran and being able to go to the VA, that these classes are available has been a huge help. I know, of course, many men and women who have fibromyalgia who are going to civilian doctors and, okay, we're going to treat your pain, we're going to treat the symptoms. They don't talk about pain management classes. They don't talk about biofeedback methods. They don't talk about meditation, using that to manage pain. So in many ways, I hear a lot of bad things about the VA. Maybe it's because Tucson is currently rated the second best in the nation. But having access to these classes, I know has really helped me in my pain management to find a way other than medications.
It sounds like they're allowing you to be in control and have a little bit of control over your pain, which is really nice.
Correct. And as a matter of fact, just last week I graduated, and I use the air quotes on that, what the VA calls their whole health system,
Okay.
which is teaching patients to communicate with their medical providers and learn to ask questions to become their own best advocates.
That's amazing.
Because when it comes to the healthcare team, really, I'm the one in charge of my healthcare. I have the team at the VA and the medical providers, but I know what's going on with me day to day. They don't.
Right.
You know, so I have to be able to say, I want to try this treatment, or this treatment isn't working, and here's why.
That's amazing.
You know.
Well, Norman, in addition to pain, what other symptoms do you have with fibromyalgia?
Fatigue is a huge issue, and part of that is from the chronic fatigue ME, and learning to live within the fatigue, and sometimes, many times, is harder than living with the pain. There's days when I'll wake up, I'll feel great in the morning, go till about 10 o'clock in the morning, and my brain stops, my body stops. I have no energy. I can't focus.
Oh, and brain fog, right? Brain fog?
Yeah, with the brain fog, the lack of energy.
Yeah.
This is a common example, but something that actually happened to me yesterday. I walked around the house for 30 minutes trying to figure out where I put my coffee cup. It wasn't in the microwave, wasn't on the counter. I put it in the toaster oven to warm up my coffee.
Oh, no.
Oh.
And the toaster oven is on the opposite side of the kitchen from my microwave. So it makes no sense why I would do that.
But
that's where my brain was yesterday.
Right.
You know, along with the brain fog and fatigue, of course, on the pain scale of 1 to 10, you know, I'd say I'm about a 4 to a 5 every day.
Okay.
But at least a couple times a week I get up to an 8, which, you know, I'm using a cane or a walker to get around the house because I can barely move.
I'm sorry.
But with the back issues I have, the neck issues, the discs in my neck and back that are getting compressed, it can be a hit or miss, you know, with weather, with different outside stimulus coming in. There's a lot of different factors day to day that, you know, I could have a great day, or it could be I start off with a great day, it ends up bad. Start with a bad day, it ends up good.
Okay.
So with all the symptoms, sometimes it's a juggle just to find out what today is going to be.
Right.
I can imagine you have to be able to alter your day depending on how you're feeling, and it must happen frequently.
Well, for me, I like to, and this is something I've learned to do with fibromyalgia, is I have a written planner and a written, and of course my online Google calendars. But I have actually learned to map out my days. I'm working more on time blocking right now than anything else. But Monday, Wednesday, and Fridays, I consider my busy days because just house chores, because I'm not able to get out of the house and actually work a traditional job. So I've sort of regulated myself to a house husband position. So Monday I'll do dishes and basic and vacuum. Tuesday is my laundry day. That's more of a rest day, just one household task. Wednesday I'll do like dishes. I have to take the trash out, clean the litter boxes. Again, more of a busy day. Thursday again is a laundry day. Friday, any tasks I didn't get out done throughout the week is when I pick those up. But actually learning to set a schedule within the area I know I can get these done this day.
Right.
Even if I'm in high pain or really bad fog, these are the basics that I know I can do.
Just one quick question. Do doctor's appointments interfere with your schedule, and do they tire you out even more?
They can. The last few weeks I've been at the VA at least every Tuesday for the whole health class. Mm-hmm. And when I get home, I'm exhausted. I'm done.
Right.
Fortunately, they were in the afternoon, so I could start the load of laundry in the morning, put it in the dryer when I get home. But when the wife got home, she looked at me and just knew I was done because I could barely get 3 words out of my mouth without not making sense. Mm-hmm. So appointments can definitely cause some issues, along with running basic errands. When I know appointments are coming up, I try to adapt my schedule as best I can. However, as I'm sure you guys know, life happens.
Right.
There's times when things come in where we have no control over. And this is an example. We were talking a little earlier about people I know with fibromyalgia. I think it was 2017, my wife actually got diagnosed with fibromyalgia.
Wow.
So there's times when I'm in a flare, I'm hurting. Fortunately, she can still go to work, but she comes home and I take a look at her and I'm like, okay, no matter how much pain I'm in, I'm the caregiver now.
Right.
Wow.
Right.
I have to push all my stuff aside and focus on her because she's the one going out earning the money. So this is my opinion, but I personally have to focus on her and make sure she's strong enough to be able to continue to work. Mm-hmm. Where I'm not able to do that.
Well, and I know from personal experience, sometimes being a caregiver can be a really good distraction from your own pain.
It can be. At the same point, when I'm in a flare and barely moving, and I see that the wife is in a flare and barely moving, it's a distraction. But at the same point, I know tomorrow it's going to be a lot worse because I'm ignoring and not taking the time for self-care to take care of the wife. And I'm not complaining about that. Please understand. The fact that I get to take care of her, that's a huge thing. But there's also the checks and balances saying, okay, I need to take care of myself, but this is more important right now.
Okay.
Well, my next question, Norman, was actually going to be about healthcare, about your healthcare, and how your wife or family and friends, how they've helped with you. But considering what you just told us about your wife having fibromyalgia as well, I'm sure that this has got to be a difficult task to try and balance.
It is nice having a wife that understands chronic illness, between her thyroid issues, now her fibromyalgia, and having a supportive spouse is huge. And just on a sort of sidetrack here, communication in any relationship is key. Whether it's, a spouse, your doctors, family, friends. Most of my friends at this point are really online within the chronic illness community. So, having different chat groups, the Men with Fibromyalgia Men's Only Facebook group is a huge help because there are some things that men want to talk about with just men, but we also have the group out there that has men and women, so there's the different perspectives there. But when it comes to having the assistance with the healthcare, this last year, I've definitely had family and friends, or my wife and friends, helping to take care of me.
Well, that's good.
But 4 different appointments. I don't think I mentioned this in the bio I sent in to you guys, but last year I had an appendectomy go wrong. It was last June, and I'm finally on the last round of healing, but 3 surgeries later, it took my wife and friends doing a lot of carrying for me to get me through this year.
Wow. 3 procedures for...
1 appendectomy.
Wow.
You're not having a good year. We're going to say 2019 is going to be your year.
I'm definitely looking forward to 2019.
Norman, as a former Marine, I'm sure you know the extreme expectations that can be placed on men. Do you think there is an unwanted, or unwarranted, I should say, an unwarranted stigma placed on men that have fibromyalgia?
Yes, and there's a few reasons I say that very definitely. Shortly after I was first diagnosed, this sort of goes to the founding of Men with Fibromyalgia, but I reached out on a couple Facebook groups that I found at the time, told my story, how long it took to get a diagnosis, things the doctors told me, like it's just a woman's disease, and obviously it's not because, well, I just got a diagnosis. And one of the responses I got back that just still sticks in my head, and I've actually gotten this quite a few times over the last 2-3 years, but it was a woman who approached me and said, why do men keep trying to steal our disease? It's not your disease, it's ours.
Oh, my God. Wow.
Yeah, it just totally blew my mind. And I've heard that from other people throughout the years. Back in 2014, the CDC actually had the numbers on fibromyalgia, and they said 1 in 8 people with fibromyalgia are men. And then 2014, I think it was, 2016, it went to 1 in 7. Well, I started gathering numbers from different men, sent them into the CDC. I still do that. And the more information I get, I send it into the CDC and say, hey, I think the numbers are wrong. Currently, the
Good for
CDC
you.
is saying 1 in 3 men, or 1 in 3 people with fibro are men.
Good for you.
But the fact that, I've had male and female doctors say it's a woman's disease, within that medical community. Even on different blogs, I see a lot of chronic illness bloggers or fibromyalgia bloggers say, it's primarily a woman's disease. Well, it's not. That's, the numbers have shown more and more men are being diagnosed with fibromyalgia. Really, my personal belief is men, women, and teens get fibromyalgia equally. Mm-hmm. And the sad part is, I know people 12 years old who have fibro. So fibromyalgia, in my opinion, is becoming an epidemic. And we really need to find the cause so we can work on finding a cure.
Makes sense.
But to go back to Ron's question, I sort of bunny trailed there. I think you asked, is there sort of a stigma placed on the men with fibromyalgia? Right. Along with doctors saying it's primarily a woman's disease, women with fibromyalgia saying, it's a woman's disease, men really don't get it, or it's really rare. Well, when men hear that, they feel weak.
Oh, okay, I could see that. I could see yes.
And so, sort of looking at it from a Marine's viewpoint, and traditional upbringing, I was raised to be the breadwinner. I was raised to be the protector. Mm-hmm. I was raised to be strong, push through anything, and turn around and spend 4 months on the couch because I can barely move. Go through different part-time jobs because I can't keep a job, because I can't show up for work because I can't move off the couch, or I'm just not able to focus on doing the job I need to do. Not being able to go out and go camping, not being able to go out and bring the groceries in because I can't lift them because my arms are too sore. Having to rely on my wife to be the breadwinner.
Right. I think there's 2 things here. One, you're not in pain if you're not bleeding. I think that's sometimes one of the aspects that comes out. If there's no blood, you're not in pain. And the other one, when you're talking about the percentage of people, men and women that have the disease, I think a lot of times the men might have the stigma of, I got to just deal with the pain.
And that also carries over just into the military as well, where in the military they always say suck it up and drive on, where if you're in pain you're supposed to push through, and that's not always possible.
Right. Hey, Norman, is that why you were inspired to start the support group on Facebook called Men with Fibromyalgia?
That is part of the reason. When I wrote that story in the one Facebook group, just telling my story, and the lady reached out and said, quit trying to steal our disease. In the same thread, I had about, I don't remember the exact number, but I want to say about 25 different men in that group of 1,000 reach out and say, hey, can you help us tell our story? And I'm like, this is important. After the comment from that lady saying, quit trying to steal our disease, I'm like, okay, men aren't being heard here. And obviously we have fibro. So I started the website then with Fibromyalgia specifically to help other people tell their stories. And that was really my only intent. And here we are 5 years later, and I'm considered an advocate in the field. Or an expert in the field of fibromyalgia, and I have no idea how that happened.
Well,
there's a lot of persistence.
Yes,
you just keep doing it.
Right, and if it was interesting to you and it was important to you and you kept doing it, you just rise to the top. I mean, thank God for that. You know, I'm sure there's a lot of men that needed you to be out there and be the pioneer.
And I have heard that you're referred to as Mr. Fibro.
Mr. Fibro.
Yep, that's actually a name that was given to me by some of the people in the men's only group, and it sort of trickled out to other groups, and it sort of stuck. So I just run with it.
That's all right.
Norman, let me ask you, have you noticed that anything makes your symptoms better or worse? What can you tell us about that?
Things that make symptoms worse, of course, are stress, lack of restful sleep, weather changes. We have a lot of wind here, which of course can change the barometer, which definitely increases my fatigue and pain. Monsoon season is right around the corner here for Arizona, which is always a fun season for me because it's clean and beautiful in the morning, and by the afternoon we have thunder showers. So I have to adapt my schedule during monsoon season, knowing in the afternoons I am going to be in higher pain. As for things that have made my symptoms better, definitely focusing on meditation, breathing techniques, distraction techniques. I have a coloring book next to me probably 50% of the time. Just do something to keep physically active when my pain's higher. I also use what's called PEMF therapy, which is pulsed electromagnetic frequency therapy. I was first introduced to it by the VA. Basically, it's a big suitcase with a huge magnet you hold on your chest for like an hour, and you had to go to the VA for that treatment. However, through blogging, I found out that there's a new company called Oscar Wellness that has a pocket version, where a suitcase version is anywhere from $9,000 to $10,000. This little pocket version is $400, and it's just as strong as the suitcase one. But I wear that Oscar around the house most of the day, and I found I actually started using it when I was doing the med paper off a couple years ago. I credit a lot of being able to get off the meds to that Oscar Pulse, because it really has helped with my mobility. And of course, with more mobility, I can do light exercise like yoga or Qigong, which is more stretching the muscles and just keeping yourself limber. But in doing that, I found overall it helps me to keep the pain less.
And I actually wonder if the PEMF is similar to maybe like a TENS unit. But yeah. Norman, what advice do you have for someone who's been recently diagnosed with fibromyalgia?
Well, the first thing someone who's been recently diagnosed with fibromyalgia that I want you to know is you are not alone. There are a lot of great organizations out there. The National Support Fibromyalgia Network, or supportfibro.org, is a great one. Of course, there's a lot of different groups out there. If you're a parent with fibromyalgia, of course, there's different challenges you can have. I know Brandy Clevenger has the website Being Fibro Mom, which focuses on parenting with fibromyalgia, so that's huge. But you're not alone. And I know there's a lot of different groups doing research out there, again, trying to find the cause of fibromyalgia, so hopefully we can find a cure. So don't give up hope. Reach out to different support groups, whether they're on Instagram, Facebook. Reach out to a couple nonprofits. There's a lot of great resources out there. And don't be afraid to ask questions, not just in the support groups or of these nonprofits, but ask questions of the medical team and let them know you actually want to work with them and not have them just diagnose you and treat your symptoms. Take an active role in your healthcare. And just to amplify on that, with one last thought, is with fibromyalgia or any chronic illness, you did not get sick overnight.
Right.
And you're not going to get well overnight. There is no magic pill. It's going to take time. It's going to take finding the right treatment for you, because I know not every person with fibromyalgia can do the same treatment. I know some people who do great on Lyrica and gabapentin and live almost in what I'd call a normal life. Lyrica and gabapentin for me made things worse. So it's going to take time to find the treatment that works best for you.
Right. Norman, we understand that you have a book coming out soon. What can you tell us about your book?
Well, the book, sort of self-titled Men with Fibromyalgia, is a half collection of stories from different men with fibromyalgia, what was involved with them getting a diagnosis, some of the stigmas they had to overcome, some of the self-stigmas they had to overcome. Like I said earlier, for me, having to overcome, I'm the caregiver, I'm the provider, and realizing that, I know this is a podcast, but pardon my language here, that I wasn't a useless piece of shit, because that's how I felt. And a lot of men have different things they have to overcome, realizing that life is different. The other half of the book is things I have learned along my fibromyalgia journey that have helped, whether it be different medical treatment, some of the ACT or CBT training that I'm able to share in the book, things that will help people find different treatment options and different paths that might work for them.
That sounds amazing, and exactly what somebody with fibromyalgia is probably looking for, because they want to know that somebody's walked that road and here's what worked for them, and something that maybe they could give a try as well. Norman, where can our listeners learn more about you and fibromyalgia?
Well, of course, menwithfibromyalgia.com is our main page. You can find us on Instagram and Facebook, also on Twitter under the same name.
Okay.
The International Support Fibromyalgia Network, that website is supportfibro.org.
Okay.
We have some great information there. Also, newly launched, and I think you may know the person I'm talking about, Crystal Kent.
Yes.
We're actually sort of collaborating with her on the Veteran Voices for Fibromyalgia Facebook group.
Okay.
Which is tailored specifically towards veterans, because we found out from some of the VA numbers that we've received recently that 80% of the veterans coming back from overseas service are getting diagnosed with PTSD and fibromyalgia.
Oh, wow.
But the VA still doesn't have an actual treatment plan in place for fibromyalgia.
Oh, wow.
Well, you are going to help them build one.
Yes.
That's our goal, and that's our hope.
That's wonderful. And thank you for everything that you do on behalf of those with fibromyalgia. And I want to thank you for taking the time to speak with us today.
Yes, thank you, Norman.
Thanks, Norman.
Not a problem. I appreciate it. And as I said, I never planned on becoming an advocate. My personal beliefs, I believe in God, and in some ways I sort of feel like Job. God gave me this illness and said, now we're going to use it for my glory. But never planned on being here myself. It's blown where I'm planted. Mm-hmm.
Okay. Well, if our listeners have any questions or comments related to today's show, they can contact us at podcastdx@yahoo.com, through our website, podcastdx.com, on Facebook, Twitter, Pinterest, or Instagram.
And if you have a moment to spare, please give us a 5-star review wherever you get your podcast. As always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice or diagnosis or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regime. And never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast.
Till next week.